Hi everyone, I'm Lea Pearson, an injury prevention specialist for musicians and founder of Music Minus Pain. Welcome to this video about body mapping. I've been studying and teaching body mapping for the past 20 years, a little bit more. And sometimes I get asked the question, well, isn't body mapping just a quick fix for playing related pain? How can something so simple make such a difference? Well, this is a both and answer. Both yes and no. But before we get into that, I just want to talk a little bit about what playing related pain is, because there are several different kinds, and I am not a medical doctor, so I'm going to be doing my best to explain it from a body mapping perspective. And you'll probably want to go look for more information about this elsewhere. But I'm not going to talk about specific medical conditions so much. It's just what are the kinds of situations that can cause pain, because there are a lot of different kinds. But we want to start with the understanding that music, sound, is created by movement, right? Every single sound you make is created by movement of some kind. And it is some of the most subtle, exquisite and expressive movements that human beings can make. Much of the pain that musicians experience is caused directly by the kinds of movements that we make or don't make. Sometimes we get stuck. For example, if a violinist does not have free use of the bow arm, their nerves and blood vessels are going to be compressed. And the muscles and the connective tissue in the arm and the hand will all be stressed from continual tension. And when this occurs over months and years and decades, the results can be serious and sometimes career-threatening. This violinist will also have limited ability to be expressive, to change tone color, to change volume, all kinds of things that are dependent upon the bow arm, full free use of the bow arm. So there can be, why is that person's bow arm not free? There can be different causes for this kind of injury. Sometimes we have acute injuries caused by a very specific action, like you bend over the wrong way to pick something up and you pull a muscle, or you break a bone. I recently got a stress fracture in my foot, and I can tell you it's affecting the movement of the entire rest of my body. If I weren't paying attention, it would cause me lower back pain. Okay? So many other injuries that seem to be sudden are caused by long-standing habits of movement that weaken the body and set the stage for injury. I compare this to plastic fatigue, where you bend a spoon again and again, and suddenly it breaks, right? So, for example, a tendonitis injury may come from overuse combined with misuse. A musician may have been playing with extra upper body tension for years with no obvious problems. But when they suddenly increase their practice, like at music camp or at the beginning of a semester or before an important concert, then the tissues get inflamed and tendonitis or even numbness can ensue. So I had an example like that, where for many years my left shoulder was weakened by compression when playing the flute. I didn't know how to use my left arm, left shoulder, and began with my arm going numb, my hand going numb, but it got worse over the years. Then one day I was trying to get into my kayak and I slipped on a mossy surface and my left arm was jerked out of place. I ended up with a rotator cuff injury, which still comes back from time to time. So it wasn't just that one action that caused the injury, it was that this whole structure had been weakened over the years and decades that I had been using my body in a way that it wasn't designed to work. So there's also pain and injury related to structural or medical pre-existing issues, like having an extra tendon or missing a vertebra, or having arthritis. I have arthritis in my right hand. It's curving my fingers a little bit and causes some pain. Or a degenerative disease like multiple sclerosis. In those cases, body mapping can help you learn to use your body in the freest possible way, but it may not solve the cause of the pain. So what I want to talk about today, that body mapping can specifically and most effectively address, is the pain and injury that's directly caused by the movements we make or don't make while playing. But the first thing and most important thing, however, is to recognize that in order to heal, we really need a team. So if you're a player, expand your concept of resources. And if you are a teacher, it's really important to know that your students will need all these things when recovering from an injury. The first person you need to see is a medical professional, whether a doctor or an orthopedist or an osteopath. Get a medical evaluation of your situation, because pain in one area does not always mean there's something wrong with that area. And if the pain is caused by a tumor or by cancer or something else medical, it's essential to find out. It's not always as simple as it seems. And once you get a medical evaluation, then you can work with a body mapping coach or a body mapping educator, as we're now calling ourselves, and get an evaluation of what's actually going on when you're playing. You might also need some body work to release tension and pain through massage or chiropractic or Alexander technique or Feldenkrais. And because muscle imbalance is often part of injury, in other words, we're overusing some muscles and underusing others, we need someone to help us restore balanced muscle use. Either a strength trainer who specializes in working with musicians. I'm going to give you a resource for that with Music Strong in the comments. Or a physical therapist who understands the whole body needs of musicians. But where body mapping comes in is to help us restore pain-free playing, whether we want to resolve nagging tension or prevent injury or actually recover from pain and injury after medical treatment or surgery. For most of us, I'm not saying for everybody, but for most of us, body mapping is the most direct and effective way of finding the best way to use our bodies during the time we are actually playing and singing. Why? Because body mapping was designed specifically for musicians so they can learn the most expressive, efficient, and effective ways of moving. Coaching with a body mapping educator helps us look exactly at how we're using our body when playing or singing. Do you know how you're using your body when playing or singing? Do you know exactly what you're doing? What are all the subtle movements that you are making? Have you watched yourself? Do you have the foundational knowledge to be able to interpret what you're seeing in yourself or your students? So if you want, you can type in the chat, whether you're watching now or the recording, what are the kinds of pain or injuries that you're dealing with in yourself or your students, because that really helps us to get more specific here. So how does it work? Body mapping coaching, well, and how do we find out if it's a quick fix or not? Let's look at a specific example. So if I ask you where your head moves from, or another way of saying it is where you think your head attaches to your spine, see if you can identify and locate that place right now. See if you can actually tell, okay, if I'm looking around the room, where is my head moving from? All right? Most of you, not all of you, because some of you know this already because you've been working with me for a while. Most of you are going to say somewhere back here, okay? The back of the neck. That's the most common answer. I've had some people who say way down here, some people who say up here, some people say here. It varies depending on what you think. But what we have to be able to do is identify that the joint where the head attaches to the spine is way up here at the top of the spine, way, way, way up there, right between your ears. So if you really want to find it, take your fingers and walk your fingers back along your jaw so you find your earlobe, and then right behind your earlobe there's an indentation. And we're past Halloween, but if you want to go all Frankenstein now, right now, you stick your fingers in there, and if your fingers could go in about another 3/4 of an inch on each side, maybe a little less depending on you, you would touch the top vertebra of your spine. It's quite wide, and your head balances on that top vertebra. So the answer to the question, where does your head move from, is way up here. Now, if you've never thought about that before, you may suddenly feel more freedom in your head and your neck, and if you can maintain that a little while you're playing, you're going to get more freedom, more sound, maybe more ability to be expressive. You might feel that your whole body is freer, and that your arms are more released and your fingers more flexible. And I can do this with you in 10 minutes. You might not know, however, why. But this is what happens when I give mini lessons at a convention or lead a master class or coach at a retreat. We release arms, we free up breathing, we relax the throat, we play more expressively and with more full-bodied sound. That kind of transformation is quick and effective and can be quite dramatic in a masterclass situation. When I'm coaching in a masterclass and someone's sound hugely opens up, or they become infinitely more musically free, in the audience the eyes open wide and people smile at the beauty they're hearing and seeing. It's an incredible moment of joy, and I've seen it happen hundreds and hundreds of times. So, yes, that is a quick fix and a moving testimony to the power of body mapping. But how do we maintain it? How do we really know and understand why that happened, and what can we do to do it again? So we have to remember that movement is a habit, like anything else. And from the perspective of body mapping, movement is a habit of thought. The thought about where your AO joint is, whether it's off or actually anatomically accurate, how your shoulder works, or what supports you. They're all habits of thought that become habits of movement. And those habits of thought / movement are your body maps. Let me say that again. Those habits of thought / movement are your body maps. So, while you might be able to quickly change your movement in 10 minutes and find the freedom at your AO joint or your arm, maintaining it is another issue altogether. You have to change the thoughts or the map that got you stuck in the first place. Now, have you ever tried to change a habit? Write in the chat something that you might have tried to change. It might be, I had to try to change biting my fingernails once, or being irritated at a certain person, or getting up at a different time in the morning. What did you have to do to change that habit? How long did it take? Changing habits is hard work for this reason. The brain is wired to maintain habits. It's a survival mechanism from thousands of years ago, embedded in our DNA. So to change a habit, we have to intentionally and mindfully practice, got it? Practice the new thought and the new movement, change and practice the new thought and the new movement again and again until it becomes remapped, rewired in our brain. This is hard work, and it takes time. As Sarah Del Bene wrote in her wonderful article about our latest body mapping conference, this is a lifetime of work. I'll post the link to her article in the comments a little bit later after this. I've been at this for more than 20 years, and I'm still learning every day. My fractured foot is teaching me even more about how feet work and how they affect the rest of our body's movement. Every student I work with teaches me something new. Every new piece I work on and learn teaches me something new about my body, how I can use it better, how I can be more free. And the cool thing about this is that when you're changing a habit, you really want the new habit to be more rewarding than the old habit. So your brain starts to go, oh yeah, I like that one better. I'm going there. And when you can play more freely, more expressively, with more comfort and more ease, your body wants that. And your brain wants, oh yeah, I can do that. Yes, yes, I can. So I expect to be doing this work directly or indirectly for the rest of my life. I'm curious, aren't you? Always interested in how the body is designed to work naturally and how we can improve our quality of life by tapping into that process. It's the one reason I enjoy so much being around small children. They mostly move beautifully and provide us incredible examples for how to be in the world. So, what's your answer? Is body mapping a quick fix? What do you think? Let me know. I'd love to hear your comments below. I'm going to be following the feed, so please write even when you are watching the recording, if you're not live. And please do love and share these videos. If you do love instead of like, the Facebook algorithm thinks that's more important, right? So we need to help more musicians become free of pain and injury and better able to express their true artistry. So, thank you so much for giving this time to yourself today, and have a beautiful day. See you next Monday.